You walked in here for a reason. You know you did. And now it's just gone. Just like that. Somebody told you that's normal. A senior moment. Just age catching up with you. I don't think that's the whole story. What if it's not your age at all? What if something else is quietly rewriting your memory, one small dose at a time? And here's the hard part. It might be something you were told was completely safe. Something sitting in your own cabinet right now. Stay with me for the next few minutes, because what's behind that door might explain more than you've ever been told. I'm counting down 7 of the biggest hidden culprits, and one pattern at the end almost nobody ever warns you about. Number 7, the nighttime allergy pills. The ones you grab for a stuffy nose or just to fall asleep a little faster. They feel harmless, practically a vitamin, but they quietly block a chemical messenger your brain depends on to build new memories. Picture your bathroom mirror after a hot shower. One layer of steam, you can still see yourself. Every dose adds another layer. Large studies following older adults for years found something sobering. The higher the lifetime total, the higher the dementia risk. It's not one bad night that does the damage. It's the running total, quietly building for years without you ever noticing it. The safer swap. Newer allergy medications that barely reach the brain at all, and melatonin instead of an antihistamine for sleep. Ask your pharmacist which pill in your cabinet counts as first generation. You might be surprised. Now here comes number 6. Number 6, medication for an overactive bladder. Completely reasonable, genuinely life-changing, honestly, for a lot of people who take it. But it works through that exact same mechanism we just covered. Blocking that memory messenger, only now running all day long. Remember that foggy mirror? This one adds another coat, and another, until your own thinking feels like a blur you're squinting through. Pharmacists actually track this. It's called anticholinergic burden, and this exact drug class often scores among the very highest. I'm not telling you to panic. I'm telling you, this deserves a real conversation with your doctor. Not silence, and not guilt. The safer swap, a newer medication class that skips that pathway completely. Pelvic floor therapy helps too, with no pill at all. Simple question for your next appointment. Is there a bladder option that isn't anticholinergic? Now, let's talk about number 5. Number 5, Benzodiazepines. The anxiety and sleep medication your doctor may have started decades ago for just a little while. Your brain has its own brake pedal, a calming chemical called GABA. This medication doesn't gently tap it, it floors it completely. Fine for one rough night, but hold that pedal down for months, and the engine memory needs to run on, never gets the chance. Beyond the fog and the confusion, long-term use is tied to real cognitive decline and a sharply higher risk of falling. This one, especially. Please don't touch your dose without your doctor beside you. We'll come back to exactly why very soon. The safer path forward, for many people, cognitive behavioral therapy. Research shows it can work just as well without this risk. Worth asking whether that therapy is available near you. Now, here's number 4, and honestly, this one surprised me the most. Number 4. The acid reflux medication so many Americans take every single morning, sometimes for 10 years or even longer. Here's what almost nobody tells you at the pharmacy counter. You actually need stomach acid to unlock vitamin B12 from your food. Turn that acid down for years, and B12 can stay locked away instead of ever reaching your bloodstream and reaching your brain. B12 deficiency alone is a known reversible cause of memory loss, and large studies link long-term use with higher dementia rates. Researchers are still untangling exactly how much is the acid and how much is the B12 underneath it. But the signal is real. The safer path, lowest effective dose for the shortest time it takes, and a periodic B12 check if you've used it for years. Now, before we get to number 3, I need 30 seconds of your time. It matters more than you'd probably guess. If any of this is new to you, hit like right now. It's genuinely how the next worried caregiver finds this video. And tell me down in the comments, has a doctor ever actually reviewed every single one of your medications together at once? Number 3. The newer prescription sleep aids, marketed for years as the safer answer to older sleeping pills. Chemically different, sure, but they lean on a lot of the same wiring in the brain, and the effect doesn't end at sunrise. Think of it like borrowing from a very persistent lender. You get tonight's sleep, tomorrow the interest quietly comes due. There are documented cases of people cooking, texting, even driving on these medications, with zero memory of it afterward. In older adults specifically, it's strongly linked to falls and fractures, and falls, quietly, speed up cognitive decline further. The gold standard alternative, according to sleep specialists, cognitive behavioral therapy for insomnia. Zero memory risk involved at all. Ask if it's available near you, even online. Now, number 2. This one touches nearly every household over 50. Number 2. Opioid pain relievers, prescribed for the chronic pain so many people quietly carry with them after 50. Bad knees, old injuries, real pain deserving real relief. But here's what that relief is also doing to you, underneath it all. These medications turn down your brain's volume on pain, but that knob isn't wired to one room. It's wired to the whole house. Alertness dims, attention dims, and the ability to encode brand new memories dims right along with it, quietly in the background. That mental fog gets blamed on just getting older constantly, when really, it's the medication doing exactly what it's built to do. The safer path is rarely one substitute pill. It's a combination. Physical therapy, topical treatments, non-opioid options, working together. And now, the one I've genuinely been saving. Not a medication at all. A pattern. And it might be the biggest culprit of them all. Number 1. Polypharmacy. Simply, taking multiple medications all at once. Something the average American over 65 does every single day. And here's the part that changes everything. None of those pills has to be dangerous alone for this to become a real problem. Picture a small rowboat. Drop in one sandbag, for the allergies, say. It barely registers at all. The boat rides just fine. Now, add a second for the bladder, a third for sleep. Still floating, sure, but lower. A little lower every single time. Keep going. A fourth for blood pressure. A fifth for pain. Notice something. Nobody decided to sink this boat. It just happened. Pharmacists have a name for this: cumulative burden. And the risk doesn't rise gently. It tends to jump once you cross a line. That's exactly why specialists push so hard for a brown bag review, bringing every single bottle you own into one appointment. Not to examine one sandbag at a time, but the whole boat, together, all at once. That's where the real answers actually live. So here's what I need you to hear next. And please, don't let yourself skip past this part. It genuinely matters. Do not stop any of these medications on your own. Not today, not cold turkey, and not just because of this video. Some of what we covered today, benzodiazepines especially, can cause dangerous withdrawal if stopped suddenly, sometimes worse than the original risk. What I am asking of you is simple and completely safe. Bring this up at your very next appointment. Ask for a full review. Ask which prescriptions are truly still needed and which ones were started for a problem that quietly resolved years ago. And here is the hopeful part, the part I really want you to carry with you out of everything we've covered today. Medication-related memory loss is very often reversible. Unlike Alzheimer's, this particular door swings back open more than people ever realize. Many people see real improvement within just weeks, once the right adjustment happens, carefully, with a doctor guiding every step. If this helped you see your own cabinet a little differently, subscribe and go check on someone you love today. Next time, I'm breaking down 5 harmless daily habits quietly raising your blood pressure without you ever noticing a thing. Until then, take good care of that brain of yours. I'll see you in the next one.